Liver biopsy. The biopsy of liver that is taken for the diagnosis of disease of liver. There are mainly two types of liver biopsy, open and closed biopsy. In open biopsy, a wedge of the liver is removed for the study and remaining edges are sutured together. And here it's a major surgery because it approaches the liver and it is open, right? So general anesthesia and major abdominal incision is needed in case of open biopsy. And the main merits of the open biopsy is we can entirely visualize the liver and we can take the biopsy and we can identify the altered tissue. Okay, so that is open biopsy. We are open the liver and taking the biopsy, and it's a major surgery. Okay, it's a because we are opening the that area, so major abdominal incision is needed. Next one, closed biopsy. The closed biopsy techniques are percutaneous in that transthoracic and subcostal biopsy, then blind procedure, then image guided liver biopsy, that is USG guided, CT guided or MRI guided liver biopsy, then plugged liver biopsy, that is gelatin or gel form plugged biopsy. So these all are the techniques that is used in the closed biopsy. Another method of liver biopsy, that is transvenous or transjugular biopsy. This biopsy is done in coagulation disorders or ascites and performed in a vascular catheterization laboratory with video fluoroscopy equipment and proper cardiac monitoring. So transvenous liver biopsy, it's mainly done for coagulation disorders or in case of ascites, and mainly it is performed in a vascular catheterization laboratory with a video fluoroscopy and proper cardiac monitoring is needed or essential in case of transvenous liver biopsy. Next one, laparoscopic liver biopsy. Laparoscopic liver biopsy, transvenous liver biopsy is not possible in patients who have combination with focal liver lesion and coagulopathy. That conditions we are doing laparoscopic liver biopsy. Next one, percutaneous liver biopsy. Percutaneous liver biopsy, this is a common procedure we are doing. The site of puncture is usually in the hypochondric region in the 8th or 9th intercostal space, and the site can be determined by X-ray or the CT or scan, and a pillow is placed under the left side and the client places his right hand behind his head, turning his face away from the procedure. Then local anesthesia will be applied or local anesthesia will be given, and the client is asked to inhale and exhale several times, finally to exhale and to hold his breath at the end of expiration. And holding the breath, that immobilize the chest wall and the diaphragm, and so that will helps to prevent the penetration of diaphragm, and the liver damage also will be minimized if the breath is holding. So physician will be do the procedure, and within 5 to 10 seconds the procedure will be over. The main general instructions we have to follow in the liver biopsy is, it will not be attempted for the bleeding tendency patients. If the patients have thrombocytopenia, if the patients have any other problems such as prolonged prothrombin time, uncooperative patient, blood dyscrasiasis, All these conditions, obstructive jaundice, all these conditions, we are not allowed to do this procedure.